General principles of pharmacology. Methods of administering drugs into the body. Drugs are administered into the body through various routes to get local and/or systemic effects. These various routes are broadly classified as enteral, parenteral, and topical, site-specific. Although humans have taken crude drugs by oral route throughout history, administration by injection was made possible by the invention of the hypodermic needle. Why so many routes? Some drugs are effective after administration through one site but are not effective at all when administered through other sites. For example, insulin reduces the blood sugar level when administered subcutaneously or intravenously. It is not effective at all after oral administration. On the other hand, antacids do not antagonize gastric acid after parenteral administration. To get the proper effect, it should be administered orally. Thus, the selection of the proper route is important for proper effect. These varieties of routes of drug administration are due to physiochemical properties of drugs, site of action, the onset of action, prolongation of effects, and adverse effects. Physiochemical properties. Physiochemical properties of a drug determine which route is ideally suited for its pharmacological effects. For example, antacids will do well in a gastric environment, whereas benzylpenicillin will get inactivated at the same setup. Morphine is usually administered parenterally. It is absorbed from the gastrointestinal tract after oral administration but has high first-pass biotransformation. Site of action. Some drugs are route-specific. For example, anthelmintics, antacids, and mydriatics. Administration of a drug to the site of action may reduce the required dose of a drug. 2 drops of timolol, 0.5%, solution, 1 to each eye, less than 1 mg, can equate to 10 mg by mouth. 200 picogram of salbutamol by inhalational route is more effective than 2 mg of the same drug by oral route. Onset of action. There are some clinical conditions where the rapid onset of action of drugs is required. In that case, most of the drugs are administered parenterally. In the case of status epilepticus, diazepam is administered by the parenteral route. Prolongation of effects. Duration of drug action can be modified by administering it by different routers. For example, if soluble insulin is administered intravenously, its effects will be terminated very soon. But the effects will be prolonged by subcutaneous administration. Adverse effects. The route selection sometimes prevents or reduces the adverse effects or exaggerated response. For example, salbutamol is well tolerated inhalation than the oral route. Enteral roots. Enteral, from the Greek word enteral, means the hollow organ. Route means the administration of drug via alimentary tract. There are several openings, mouth, nose, ear, anus, within the body. Among them, it is only the alimentary tract that has 2 ends. Enteral roots include oral administration, swallow, sublingual administration, buccal administration, the nasogastric root, rectal administration, and colonic administration. Oral administration. Swallow. Oral administration, Latin word per os, means the placement of a drug into the oral cavity with the purpose to swallow. It is the most common route of drug administration. Usually, the drugs in tablet, capsule, powder, solution, and suspension are administered. Capsules are more likely than tablets to stick or dissolve in the esophagus. Thus, there may be damage to the esophagus, particularly by the ingestion of tetracycline, doxycycline, aspirin, or oral iron preparations. This can be prevented by the concomitant administration of a glass of water. The priority of selection of this route is due to self-administration, cheapest price, relatively safe, and does not require maximal sterility. The absorption of the drug from the gastrointestinal tract is slow and irregular. Co-administration of the drug through this route may influence each other's absorption. Oral administration of tetracycline and iron is a good example. Oral administration of the drug would be useless if a patient is suffering from severe nausea, vomiting, or malabsorption syndrome. It is difficult to administer a drug to an unconscious patient. The drugs not administered orally are insulin, adrenaline, streptomycin, and benzylpenicillin. Contrarily, some drugs are only administered orally. These include saline purgative, magnesium stearate, antacids, and gut sterilizers like certain aminoglycosides. Sublingual administration. Sublingual administration means the placement of a drug underneath the tongue. Only a few drugs such as nitroglycerin, isosorbide dinitrate, nifedipine are administered through this route. Drugs are usually administered in tablet form. Sometimes the liquid form or aerosol is also used. The tablet is softened with less disintegration time, only 2 minutes in case of nitroglycerin. Sublingual administration of a drug causes rapid onset of action and bypassing the first pass effect. The bioavailability of a drug is higher. The drug can be spitted off if undesired effects develop. The drug may be more stable as the pH in the mouth is relatively neutral. The drug with a low lipid water partition coefficient is not suitable for this route. Only small doses can be accommodated easily. The route is inconvenient if a drug is frequently used. The patient has to hold the dose in the mouth, which is sometimes inconvenient. Irritation of the mucous membrane and excessive salivation may promote swallowing. Buccal administration. Buccal administration, Latin word bucca means cheek, means the placement of a drug between the cheek and the gum without swallowing it. Only a few drugs such as antacids, vitamin C, local anesthetics, and nystatin are used along this route. Drugs are usually administered in lozenge, troche, and drug-impregnated lollipop. Sometimes potassium permanganate is used for mouthwash in liquid form. Buccal tablets are often harder tablets, 4 hours disintegration time, with the purpose to dissolve slowly. The extent of absorption from the oral mucosa is largely due to its high vascularity and thinness. Moreover, it bypasses the first pass effect. The drug with good taste and/or flavor is quite acceptable. There is difficulty in keeping the drug within the mouth for the required length of time. Holding the dose in the mouth is inconvenient. Nasogastric root. the drug is administered into the stomach through a nasogastric tube. This route is not frequently used. It is only preferred in non-cooperative, unconscious, or semi-conscious patient. Drugs in solution and suspension are used. The procedure is somewhat difficult and is not acceptable to the patient. Prolonged use of the tube, however, may give rise to gastric ulceration, leading to bleeding. Rectal administration. Here, the drug is placed into the rectum through the anus. This route is not frequently used. The drugs are used for both local and systemic effects. For example, anti-hemorrhoidal agents are used for local effects. Analgesics, antipyretics, antiemetics, aminophylline, sedatives are usually used for systemic effects. Drugs in suppository form are administered through this route. Tablet or capsule cannot be administered. This route is usually chosen when the oral route is associated with gastric irritation, repeated vomiting. Non-cooperative patients, particularly children and unconscious patients. Sometimes diazepam is used to treat status epilepticus in children in whom it is difficult to establish intravenous access. The dosage requirement is almost the same or slightly more than those used in the oral route. Some of the veins draining the rectum lead directly to the general circulation, thus bypassing the liver. There is a reduction of first pass effect. The patient may be embraced and is not well accepted. Rectal inflammation may occur with repeated administration. The surface for absorption is very limited. The extent of absorption is erratic. The presence of stool in the rectum reduces the extent of absorption. Some amounts of drugs undergo the first pass effect. Colonic administration. Here, the drug is administered directly into the colon through the anus. The drugs are used for local effects or diagnostic purposes. For example, soap water is used as an enema for the treatment of constipation. It is a local effect on the colon. Sometimes barium enema of the colon is done to diagnose a case of pathology within the colon. Parenteral roots. The word parenteral is derived from the Greek words para means beside and enteron means intestine. That is, parenteral means not through the gastrointestinal tract. So, it will include a lot of routes of drug administration. Nowadays, the term parenteral has been restricted to mean the administration of drug only by injection. It includes intradermal, subcutaneous, intramuscular, intravenous, intra-arterial, intrathecal, epidural, intracardiac, intraperitoneal, intraplural, and Intra-Articular Administration. Intradermal Administration. Intradermal administration of a drug means the administration of the drug into the dermis layer of the skin. The drug in solution or suspension form is chosen to diagnose the cause of an allergy or for immunization. Only a small volume of 0.01 to 0.1 milliliters is administered so that the volume does not interfere with wheal formation or cause a systemic reaction. The inner aspect of the forearm is frequently used because there is less hair in the area and the test results will be more visible. The needle is inserted with the bevel upward at a 10 to 15 degree angle. Test results are read 48 to 72 hours after the intradermal injection. A reddened or raised area is a positive reaction. Subcutaneous administration. The injection is made into the connective tissue layer beneath the skin and allows it to spread. After injection, The drug gets disseminated into the systemic circulation after passage through the capillary. Molecular weight. Some hormones such as steroids, progesterone, levonorgestrel, are given in the form of pellets that are implanted under the skin. Here, the active drug slowly dissolves in the intestinal fluid before getting into circulation. Then pellet itself gets surrounded by fibrous tissue, which in turn further slows the rate of dissolution. Administration by subcutaneous route is safe, relatively pain-free, and simple. As the absorption is slow, it can provide a sustained and uniform effect. The route may be self-administered. Irritant drugs must not be given through this route, as local sloughing of the skin. Abscess formation may result due to unsterile. Repeated injections at one site can cause lipodystrophy, resulting in erratic absorption. Intramuscular administration. The injection is made through the skin and subcutaneous tissue to reach the muscle layer. Intramuscular administration may cause pain and trauma to surrounding tissue. Thus, the location for intramuscular administration is chosen based on adequate muscle size and minimal major nerves and blood vessels in the area. These include ventrogluteal, dorsogluteal, deltoid, and vastus lateralis. Drugs in aqueous solution or suspension are used for intramuscular injection. Drugs are chosen for this route when patients are intolerant of oral preparation, or rapid action is desired. Depot preparations of drugs are sometimes used in this route to achieve a prolonged effect. It allows the administration of more irritating drugs and of larger volumes of solutions that can be tolerated subcutaneously. The volume of solution is 0.3 to 3 milliliters, with the average being 1 to 2 milliliters. A dose greater than 3 milliliters is usually divided and given at 2 different sites. Occasionally, 5 milliliters of selected drugs, such as magnesium sulfate, may be injected into a large muscle, dorsogluteal muscle. The angle of drug administration is 90 degrees. The needle length depends upon the amount of adipose and muscle tissue. The average needle length is 1.5 inches. Intramuscular injection cannot be administered by self-administration. It is not popular with patients, especially children. Drugs too irritating to be injected subcutaneously may sometimes be given intramuscularly. Some of the injections are very painful because of their irritant nature, as in diazepam, or may cause tissue staining, as in iron dextran complex. There may be local tissue necrosis, sterile abscess formation, as in paraldehyde, and hematoma formation. Tissue staining following drug administration can be overcome by applying the Z-tract technique. Anticoagulant should not be administered through this route. Massage after injection or application of heat at the site of injection is discouraged. Intramuscular injection may interfere with diagnostic tests, as in creatine phosphokinase. Intravenous administration. Intravenous administration means the injection of drug directly into the vein. The drug is administered by either bolus injection or infusion. Bolus injection is more common. However, the disadvantage is that high peak concentrations are inevitable, as rates of distribution seldom approach the rate at which drug is administered from needle and syringe. The brain and heart are vulnerable to these high concentrations. Some drugs are administered by slow intravenous infusion to get steady-state concentration in the plasma and sustained effect. Intravenous infusion is the ideal route of drug administration to get the systemic effect. With facilities for monitoring the blood concentration of a drug or its effects, accurate adjustment of dose can be made, and this is now the preferred route of drug administration in the acutely ill patient, as in diabetic ketoacidosis. The drug is administered slowly. Some drugs may be infused over 20 minutes or more. Nowadays, some drugs, particularly if a prolonged and continuous effect is required, are administered via an intravenous syringe driver pump. This route is usually preferred when the immediate effect of the drug is desired. The bioavailability is 100%. A large volume of the drug can be administered. Drug administration can be stopped if adverse effects develop or the desired effect is achieved, as in the case of anesthetics, or morphine in left ventricular failure. Many drugs can only be given by the intravenous route because of failure of absorption from the gut. Certain drugs are administered through this route because they are too irritant to be given intramuscularly. Intravenous administration is technically more difficult, and an inadvertent intra-arterial injection can cause arterial spasm with resulting tissue damage. Self-administration of a drug is not usually possible. One trained person is required to administer the drug with the help of a syringe or infusion set. There may be extravasation, which can lead to local inflammation and necrosis in some cases, as in vincristine. Inadvertent injection of air may result in air embolism in the pulmonary or other vasculature. It requires strict aseptic measures. Intravenous administration can be hazardous in case of overdose or idiosyncrasy. The immediate effect will take place, leaving very little time to counteract. The drugs are expensive and there is an increased chance of developing adverse effects. Oily solution or suspension is not suitable for administration. Some drugs like diazepam may require a large caliber vein for its administration because of the incidence of thrombophlebitis. For nutritional therapy, TPN, the central vein is necessary as some of the nutritional fluids are hypertonic. Intra-Arterial Administration. Intra-Arterial Administration means the administration of drug directly into the artery by injection. The radio-opaque substance may be administered in the artery as an aid in diagnosis in humans. Cancer therapy sometimes includes the introduction of the drug, fluoridine in carcinoma of the liver, in an artery supplying the affected organ, and the perfusate is collected from a vein leaving the organ to prevent entry into the general circulation. This is done to expose the tumor to a higher concentration of drug, which can be very toxic if given intravenously. Intra-arterial injection of vasodilator has also been tried in peripheral vascular diseases. Drugs in solution are only used. Intrathecal Administration. The drug is administered into the subarachnoid space via a lumbar puncture needle to produce a local action of the drug on the meninges or spinal nerve roots. Local anesthetics are generally given through this route to achieve subarachnoid block for various surgical procedures. Antimicrobials for the treatment of meningitis are often given intrathecally. Neurolytic agents and various opioid analgesics are also used in this route for the treatment of acute and chronic intractable pain. Methotrexate is used to treat certain childhood leukemias that tend to spread to the CNS. Drugs in solution are used. Altered physiological effects in terms of the sympathetic, sensory and motor blockade are observed. Spinal administration requires specialist performance. It has to be done aseptical way to avoid infection. Post-dural puncture headache, PDPH, is a known complication. Epidural administration. Drugs are introduced into the epidural space in various levels of the spinal column, whereas intrathecal administration is usually restricted to lumbar space. The epidural space is filled with loose connective tissue surrounding the epidural vessels and nerve roots. It is the nerve root that gets blocked through the diffusion of the local anesthetic drugs during epidural anesthesia. Other drugs like opioids and steroids are being used to provide analgesia in the respective segmental distribution. Epidural anesthesia is characterized by physiological effects which are not different from spinal anesthesia, related to sympathetic sensory and motor blockade. Like spinal, epidural administration also needs specialists' involvement. The amount of drug injected is considerably greater than would be needed for the spinal to block the same number of segments. However, it is associated with less complications and is considered safer than spinal. It has less chance of infection and post-dural puncture headache does not occur. Intracardiac Administration. During cardiac surgery, the potassium-rich cardioplegic solution is given to arrest myocardial electrical activity. In the treatment of cardiac arrest, adrenaline is administered directly to the cardiac muscle. This method is considered obsolete now as a better way of cardiac massage. A CD pump, electrical defibrillation, pacemakers are available. Intraperitoneal Administration. Peritoneum has a very large surface area which can be offered as a suitable absorptive surface. The root is useful for fluid therapy for patients who has poor veins, especially in the case of children. The absorptive surface is exploited in peritoneal dialysis in acute renal failure when dialyzing solutions are introduced and the waste products are removed from the plasma. Intrapleural Administration. Intrapleural administration of both local and general analgesic drugs has now been introduced. It uses the pleural epithelial surface for absorption. The drug being diffused through the pleural membrane gets into the roots of the spinal nerve. An acceptable form of analgesia in the lower part of the chest and upper part of the abdomen is obtained. Intra-Articular Administration. Intra-Articular administration of the drug is chosen for treating local pathology. Drugs are introduced into the joint space. Corticosteroids are given for arthritic conditions as well as during manipulation under general anesthesia. Opioids have also been administered through this route for the relief of joint pain. Topical, site-specific. Topical application of the drug is the simplest route of drug administration where there is direct local application of the drug to the place of action. The word topical is derived from the Greek topos, means a place. Topical, site-specific routes include epidermal, transdermal, conjunctival, iontophoresis, inhalational, nasal, and vaginal administration. Among them, conjunctival and inhalational routes are mostly used. The permeability of drugs varies at different sites and there are individual variations as well. Temperature also affects absorption. Permeability of the post-auricule. AR skin is 10 times greater than that of the skin of the thigh. Epidermal Administration. Epidermal, cutaneous, administration means the application of drug onto the surface of keratinized epithelium. The drugs in the form of an ointment, lotion, cream, liniment, paste, paint, patch, jelly, and aerosol are used. The purpose is to get the local effect. Thus, a high concentration of a drug is to be delivered at its site of action. Epidermal administration may cause irritation, sensitization, and undesired systemic effect, dermatological steroidal preparation. Prolonged use of corticosteroid cream may give rise to adrenocortical suppression in adults and growth retardation in children. The discriminate use of antibacterial agents may cause bacterial resistance. Transdermal administration. The drug is applied to the skin for systemic effects. This does not mean that any drug when applied to the skin will be absorbed to get the systemic effect. The skin is relatively impermeable to water or water-soluble drugs. Lipid-soluble drugs can be able to cross the skin. It may be up to 10 mg, 24 hours. To pass across it, the drug has to diffuse along with its concentration gradient and then get absorbed through the endothelial lining into the circulation, such as a steroid. Why do we sometimes prefer to administer this route? The potential benefits are a. Avoidance of first-pass biotransformation, b. A method of continuous administration of the drug to maintain a steady concentration, zero-order kinetic, c. Prolonged duration of action, and d. Minimal adverse effect. Only a small number of drugs can be used by this route. The desirable molecular weight should be. These include the area of the skin, degree of hydration, keratinization, and local blood flow. Application of drug to hairless, minimally keratinized area causes maximal absorption. Absorption of the drug through the skin can be enhanced by suspending the drug in an oily vehicle and rubbing the resulting preparation into the skin. Local blood flow may be changed greatly throughout 24 hours with atmospheric and body temperature. Conjunctival Administration. Conjunctiva, being a very sensitive organ, would allow only a selective number of drugs for administration. This route is chosen mainly for local effect, such as local anesthetic, drugs for the treatment of superficial infection, although the effect after penetration through cornea, such as miotics and mydriatics, is obtained as the preservatives of the dosage form are not virucidal. The serious ocular infection may ensue if contaminated. Although a certain amount of drugs get absorbed through the conjunctiva to get into the circulation, no significant effect can occur. The ointment is preferred for prolonged effect as the solution gets washed away by the secretion of the eye. Iontophoresis or electrotransport of drug. The major barrier to non-lipid soluble or ionized drug for crossing the skin is the stratum corneum. Pores through sweat glands and hair follicles are the routes through which these drugs can pass, although the surface area of the pores is pretty small. The rate of transfer can be increased by electricity, and this phenomenon is known as iontophoresis or electrotransport. There are bright prospects for drugs like lignocaine, NSAIDs for local use, and opioid for systemic use. Inhalational administration. Absorption of lipid-soluble drug is rapid from this route because of the very large surface area is provided by the alveoli, which are also associated with a rich blood supply. The rapidity may be compared with intravenous administration. Apart from volatile anesthetics, sympathomimetic amines, steroids are commonly administered through this route to relieve acute bronchospasm. Adrenaline is also given for its beta effect on the heart during cardiac arrest. Of course, the adverse effect may occur with this drug due to the rapid absorption. In a situation like this, the concentration of a drug is very important. Salbutamol is administered in smaller concentrations for the treatment of bronchodilation and does not cause any problem for absorption. This route is devoid of first-pass biotransformation if all of it reaches the alveoli. But some of the drugs from the aerosol reach the stomach where these are poorly absorbed. Local anesthetic is sprayed on the vocal cord for intubation. It also has some use during bronchoscopy when the patient remains awake. Transtracheal. Through a puncture in the cricothyroid membrane or through tracheostomy tube, administration of this above-mentioned drug is also practiced in a special setting. Aerosol preparation is used either to produce a log effect or to act systematically after absorption. Nasal administration. Xylometazoline, vasoconstrictor drop, or propylhexedrine, vapor, for nasal congestion is used. Exploiting its reasonable surface area, opioid has also been administered for selected patients to achieve analgesia. Few drugs, vasopressin tannate, canoba snuff, and cocaine, are taken as snuff, fine powder, for desired systemic effects. The common cold, sinusitis, and hay fever affect absorption adversely. However, certain hypothalamic and pituitary peptides are given through this route as they are destroyed in the gut. Opioids, steroids, histamine antagonists, propranolol, vitamin B12 can also be given. To reach cerebrospinal fluid, this route has a great advantage as the contact with the subarachnoid space of the olfactory lobes. Vaginal administration. Some drugs, in the form of a suppository, tablet, cream, jelly, or pessary, are administered into the vagina for the treatment of local infection. Spermicidal agents are used. Radioactive needle, cesium, implantation for the treatment of carcinoma cervix is also done. Normal saline is sometimes introduced into the uterus through this route to test the patency of fallopian tubes.